So welcome everyone. I'm really delighted to welcome you tonight to the third Menopause Masterclass. And in tonight's session, we are going to be looking at pelvic and intimate health, which is sponsored by Always Discreet, a brand that has a range of products designed to protect against bladder leaks. So for those of you that are tuning in for the first time this evening, my name is Leslie Salem. I'm 49 years of age and I'm in perimenopause, and I'm the proud founder of OverTheBloodyMoon. I'm also a certified menopause health coach. Now, a few years ago, I was sitting, perhaps like you, not feeling myself. I was confused about whether this was down to hormones or other aspects going on in my life. And to be honest, I felt completely overwhelmed about how to manage my menopause. I took the decision to take charge of my change and to work out what elements in life were going to nourish me and to shed those that no longer served me. And my menopause journey a few years on has taken me on this fantastic path of self-discovery. I decided to set up OverTheBloodyMoon to share with you some of these lifestyle adjustments and how I kind of reframed my mindset. And really, I've pulled together all these fantastic clinicians around the world to bring to you curated, trusted information with different options to help you manage your menopause. OverTheBloodyMoon believes in 3 T's for this happy transition. So firstly, a team. There's so much going on in menopause. It affects so many different aspects of our life. We need a whole team of specialists, but it's expensive, right? So we bring that together on masterclasses such as this and other services and products that we do. We also share with you their proven tools, evidence-based tools, so you can pick and choose which ones are right for you. And of course, the final T is a tribe, which is all of you, fantastic, dynamic people sharing their stories, the ups and the downs, but most importantly, we're there to support each other. So I'm just going to share with you some of the services that we do. Just to share with you the services that we do, we are here for you as individuals. We have the masterclasses such as these. We have a digital well-being platform called The House, which has got lots more videos to cover every aspect of your health. We have some menopause self-care cards, 52 challenges for every day, for every week of the year. We also have workbooks on deep diving on how to improve your menopause management, and lots of free resources on our website. And if you work, we also can come in and help support, cultivate those important conversations. So if you want to and like the session after tonight, please go and chat to your HR people. So that is enough about kind of, OverTheBloodyMoon, apart to say that we want to empower you, we want to educate you and equip you so you feel that you can own your menopause. And that's very much aligned to why we decided to partner with Always Discreet. We love their philosophy and their tagline, menopause, you live it, you define it. And so I'd just like to share with you now a video on why Always Discreet feel as passionately as we do about menopause.
Historically, Always as a brand has focused on puberty age girls, as we know this is a critical moment in their life when they experience a drop in confidence. Through our groundbreaking campaigns, we aim to inspire those girls and build them back up again. Now, with our Always Discreet brand, we want to help those experiencing another life stage, menopause. Menopause is so much more than when your period stops. But with the topic still considered a huge taboo, it's no wonder in a recent study by Gen M, 2 in 3 women feel completely unprepared for it. At Always Discreet, we're on a mission to empower those experiencing menopause by driving education to help them understand and manage their symptoms with confidence. We're so pleased to be sponsoring the series of menopause masterclasses hosted by OverTheBloodyMoon, because we want nothing more than for you to live your menopause your way.
Brilliant, fantastic. So just to say and remind people, we've got a disclaimer here. So we are going to be sharing with you information from clinicians, but it is really important that you do go and see a healthcare specialist, particularly if you are learning that some of the aspects that we're sharing with you are not normal, and that you need to kind of go and talk to a specialist. And also, if we can ask you not to take any screen grabs without permission, and to publish that. I would like to invite you, that you've already been using the chat because of some of the tech issues. I hope that that's the last of it. But we also have at the bottom a Q&A. So we might not have a chance to cover all of these, but we will try whilst we're waiting. The clinicians can go on and maybe answer some of the Q&A, and we'll certainly do our best afterwards in a newsletter. So get chatting, and we will be feeding those through to some of our clinicians later on today. So in this section, we're just going to give you a little bit around the science of what is going on in our bodies that might be impacting on our pelvic and intimate health. And then we're going to be running through with our clinicians in more detail. So you're going to get a good understanding. Most importantly, you're going to walk away with some tools and self-care tips that you can introduce into your life. So what is happening with our hormones during the menopause journey? Well, firstly, there are changes and drops in a hormone called estrogen. And estrogen plays many different functions in the body. But one of the things that it does is it holds the muscles and the tissues together. It strengthens them. And so when it declines, our muscles and our tissue will weaken. If you think about collagen, with our face, for example, it's the same around our body. So when it starts to decline, it means that our muscles start to sag, and that they're not holding up our organs as tightly. And also in the vaginal area, the tissue starts to get thinner, and that over time and with abrasion and irritation can cause pain and discomfort. So we're going to be hearing more about that when we talk later on to Dr. Sharma and Dr. Wright. Another aspect of estrogen is that the pH in our vaginal area starts to change. So it should be around 4.5, which is quite acidic. And as we go through menopause and the estrogen changes, that starts to change and it becomes more alkaline. And we're going to hear later on about the impact of that on bacteria and recurrent UTIs. And then another hormone that also changes is testosterone. Testosterone, we sometimes think about as men, but we have it. And when that starts to change, it can impact on our sex desire and our libido. So when we're going to talk again a little bit more about that later on, but when it can go up, so for some people, they have a sex surge when testosterone is the dominant hormone, but also it can decline as well for some people. So we're going to be talking about how you can manage that for yourself and if you're in a relationship. So intimate health and pelvic health, why did we decide to do a topic? So, you know, beyond being sponsored by Always Discreet, which are obviously very passionate and have a range of products to support, it is a taboo. It's just not talked about. And yet it is so common. So 1 in 3 women over the age of 18 will experience bladder leaks. And this goes up to nearly 60% for those post-menopause. And many people are just ignoring it and just accepting that that is okay. But we're here to say it's not, and there's things that you can do to improve that. And when it comes to discomfort in the vulvovaginal area, nearly half of people post-menopause can experience that. And again, thinking about things earlier with interventions and self-care rituals at an earlier age can really have a positive impact and alleviate and reduce that. And then finally, we've spoken about the change in alkaline or the vaginal environment becoming more alkaline. 55% of postmenopausal women will experience recurrent UTIs. So again, we'll touch a little bit on that. So I guess the key message here is that, today is all about educating, helping us understand what are the early warning signs, and that just because lots of people experience it doesn't mean it's okay. And hopefully as a result of the session, you'll feel inspired and it will be time for action. So I am delighted to move on to our section on pelvic health, and we are going to be chatting or listening to Nicky Travlos. So Nikki is an experienced pelvic health physiotherapist and has been working many years for the NHS, as well as having her own private practice, Invictus Pelvic Health. Nikki also runs a 7-week online course, which is called Holistic Core Restore Meno Woman. And we'll be finding out more about that in the newsletter. Nikki is going to be helping us understand more about the pelvic region, identifying those early warning signs, helping us understand what is good pelvic health and what is not, and sharing her fantastic tools and tips on how we can restore our health. So I will be back again at the end of Nikki's session, but until then, I will leave you in her capable hands.
Thanks, Leslie. So we're going to be starting with breathing. So breathing is essential for good pelvic health. And by tuning into the breath, we power up our core muscles. So enabling the diaphragm, the pelvic floor, the deep abdominal and the back muscles to work together. So you'll see from the image that the pelvic floor and the diaphragm work together in synergy. So as we breathe in, the diaphragm descends, and the pelvic floor expands. And as we breathe out, the diaphragm domes up and the pelvic floor recoils. And breathing helps us to relax the pelvic floor. So let's take this as an opportunity to pause and tune in and create awareness of our bodies and breathing, and let go of tension and stress and busyness and find some stillness tonight. If you have any concerns or you feel you can't join in at this time, just listen, and you can try out the breathing once you've consulted your health professional. So if you're sitting on a chair or standing, that's fine. Just place your hand on your chest, so just below your throat, and place your other hand on your belly, just above your belly button, and start to tune into the movement as you breathe. Try and keep your chest hands still and allow your other hand to move with the rise and fall of your belly. So bring your attention to your feet and have your feet about hip width apart, and start to feel the connection of your feet with the floor, and try and relax your other muscles. So your thigh muscles, your leg muscles, your buttock muscles, just allowing your, if you're sitting, your buttock muscles to be in contact with the chair, and then just relax your shoulders and grow tall through the crown of your head. So keeping your chest hand relatively still, imagine you have a balloon in the top part of your belly. So taking a small to medium breath in, as you breathe in gently, your balloon expands your ribs and your belly. And then as you breathe out, your balloon deflates and pulls your belly gently in. So just keeping that chest hand still, imagine that balloon in your belly. So expanding as you breathe in, and then releasing as you breathe out, and try and repeat that 6 times. So if you can, breathing in through your nose and breathing out gently through your mouth with pursed lips. So, and those pursed lips just help to extend the exhale and also helps to bring in the abdominal muscles. So if you can try that 6 times, close your eyes if you like, and just take some time to just connect with your body, create awareness, and just tune in and find some stillness there and help to relax your pelvic floor. So as you breathe, relax your body, feel your feet connecting with the floor. Feel that sense of relaxation through your pelvic floor, and allow your crown of your head to extend towards the ceiling, and just breathing in and breathing out. If you feel dizzy at all, just go back to normal breathing. So last two and last one. Well done. So hopefully now our nervous systems are calm and relaxed, and we're more aware of our bodies and of our pelvic floor. And we're ready to learn about the causes of pelvic health problems in the peri and the menopause. So we're just going to talk about the triggers. So, so we know that certain triggers increase urinary incontinence and prolapse, so bladder leaks and prolapse. So that can be childbirth, constipation, smoking, even obesity, back and hip pain, pelvic pain, heavy lifting. Certain physical activities can increase leaking, and lifestyle. So all of these things can contribute to pelvic health problems. And these conditions can be with us for many years prior to the peri and the menopause. But as our hormone levels start to decline and there's that drop of estrogen and the tissues lose their plumpness, and also over the age of 35, we lose 2% of our pelvic mass per year. So all of these conditions which we've learned to manage start to create bother for us and reduce our quality of life. So the common experiences that we see are pelvic organ prolapse, bowel issues, constipation and fecal incontinence, and incontinence and bladder leaks. So just looking at this image on your screen, if you look at the top left image, you'll see a pictorial image of normal anatomy. So your bladder with your vagina and the uterus on top in purple, and then you've got your bowel in gray. So the next image along, so the second image along on the top line, is a cystocele. So a prolapse is a movement of the organs out of their normal position, and the cystocele is a front wall prolapse. So this is where the bladder pushes on the front wall and moves into the vaginal space. So the next image along, you can see the bowel bulging into the vaginal space. This is a rectocele, or a back wall prolapse. And what can happen is that the poo can get stuck in the bulge, and that then becomes very difficult to pass. So some women find it helpful to put a finger inside the vagina and splint the back wall, or put light pressure on the perineum, which is the area between the back passage and the vagina, to support the back wall, which then makes it easier to get the poo out and easier to evacuate. And then if you come down to the bottom line on the left-hand side, you'll see the uterine prolapse, which is the uterus moving in to the vaginal canal from its position at the top of the vagina. So the symptoms that you tend to get with prolapse are constipation, so feeling like you're not able to fully empty your bowel or your bladder, and you might sometimes need to go to the toilet immediately after you've already been, so you haven't quite emptied completely. You can also get a feeling of a bulge or seeing a lump in the vagina. You can get a heaviness or a dragging sensation in the pelvis, and also back or pelvic or abdominal discomfort. So there are a couple of types of bladder leaks that you can experience. So the first one is stress urinary incontinence. So this is a leakage of urine due to pressure on the bladder. So this is not lifestyle stress. This is actual physical pressure of the organs on the bladder. So when you cough or sneeze, or with activities like jumping or running, or sometimes even just getting up from a chair, or even bending down to pick something up off the floor. So that's stress incontinence. And urge incontinence is a bladder leak accompanied by a strong urge to empty your bladder. So you know, when the bladder muscles just contract, and it's very difficult to resist that urge. So for example, if you've just been shopping and you brought all your bags to the front door, you put your key in the door, and you suddenly feel this overwhelming urge to rush to the toilet, and you experience a bladder leak if you don't make it on time. So that's urgency. So 50% of women experience a mixture of the two, so that mixture of stress and urge incontinence. So bladder leaks are common but not normal, And they can be managed and alleviated with some advice, training, and lifestyle adjustments. And if you prioritize your time now, you can improve your health tomorrow. So it's about addressing those triggers sooner rather than later and taking those first steps to getting the health and advice that you need. So I'm just going to explain to you a little bit about bladder training. So if you do visit a health professional, and they will likely ask you to do a bladder diary. So this is a timed 3-day record of your drinks and bladder output, all measured and recorded, as well as noting any leaks or symptoms you might have. And it's a very useful picture of how the bladder is behaving and what techniques might be useful to help you. So you can identify any bad habits and be taught strategies to help you get into good habits and back in control of your bladder. So you'll very likely be asked to address your fluid intake. So that's just looking at the fluid that you're taking in, making sure you're taking in enough of the right type of fluid. So about 1.5 to 2 liters per day of decaf tea or coffee, water, herbal teas, for example, and possibly reducing or even eliminating too much of the wrong type of fluid. So things like caffeine, which is a bladder irritant, which is in tea, coffee, hot chocolate. It can also be in fizzy drinks. Certain diet and sugar-free drinks contain aspartame, which is also a bladder irritant, as well as alcohol, and even acidic drinks like orange juice can irritate the bladder. So you'll be asked to reduce those irritants. And then you'd be aiming for spacing out your bladder emptying, so going every 2 to 3 hours and getting out a good amount of urine. So to measure a good amount of urine, you'll sit on the loo, start urinating, and count your Victoria Falls. So 1 Victoria Falls, 2 Victoria Falls, 3 Victoria, up to 7 or 8 Victoria Falls. And then you know you're getting a good amount of urine out. Okay, so avoid going just in case. Otherwise, your bladder gets used to emptying at very small volumes. And also waiting for perhaps the second call to urinate. So rather than going on your first call, maybe waiting until your second, and that gets your bladder emptying at a higher volume. And you might need to learn some bladder calming techniques, like the breathing we did at the beginning, that diaphragmatic breathing, together with some distraction techniques, like counting backwards from 100 in 5s or 7s, so that when you come home with your shopping, you put your key in the door, and you do your distraction techniques and your bladder calming techniques, and so you're not leaking before you make it to the loo. So just talking about medication, you might be asked to visit your GP if any medication you're taking could potentially contribute to your bladder problems. In any event, you should be having a medication review every 6 months. And of course, we know that constipation is one of the main drivers of bladder problems, and so improving this is also a priority. So we're going to talk a little bit about constipation. So preventing and managing constipation, we want to make sure we're getting enough of that right type of fluid, and it may help to have a hot drink in the morning to get things going. You want to be doing at least 20 minutes of activity, so that might be some stretches or movement if you're immobile, or if you're able to go out for a daily 20-minute walk, that's enough to get things going. You want to increase your fiber-rich food, but don't start with too much too soon. So if you're sort of spooning the all bran, you might find that things go the opposite way. Rather, just gently introduce more cooked vegetables into your diet. So lots of leafy greens, lots of root vegetables, and this can be quite simple through soups and stews, and making sure that you're getting plenty of variety of fruits and vegetables, so eating the rainbow. And studies have shown that abdominal massage can be really helpful, particularly if you have neurological dysfunction. So if you're struggling with emptying your bowels, abdominal massage can be really helpful. I'm not going to demonstrate it now, but this is something you could speak to your health professional about to see if they can help you with this. And then another really useful tool is putting your feet on a stool. And what this does is it raises your knees above your hips. And this allows your pelvic floor to relax and gets the poo out a little bit easier. Now, if you find that you have mobility issues, or you have had a recent hip replacement and you're not allowed to lift your knees above 90 degrees, then that technique is not for you. Right, so here we come onto the exciting bit. So this is just learning all about the anatomy of the pelvic floor. So you'll see from the picture that there are two different layers of muscles, the superficial layer and the deep layer. So the muscles originate from the coccyx and they wrap or thicken around the sphincters, and they come up and insert into the pubic bone at the front. So from the coccyx, wrapping around the openings to the pubic bone, and then spreading out towards the sitting bones. So the deep muscles, so there's that superficial layer and the deep layer. And so when you contract the muscles, you need to try and get that squeeze and the lift. So that's really important, from the coccyx to the pubic bone and then lifting up inside. So there's a couple of types of muscle fibers as well. So to exercise the slow endurance or postural muscles, you can hold the contraction for up to 8 seconds. And for the fast muscle fibers, it's a quick squeeze and release. So a squeeze and release. So in order to get those muscles working, you want to feel like you're closing the back passage and stopping yourself from passing wind. And you may find that as you do this, you tighten the muscles at the front as well, like you're stopping yourself from passing urine. And this stopping yourself from passing urine is not something you should do in practice, but it's that sensation that you get when you're doing your pelvic floor exercise, as if you're stopping yourself from passing urine. So remember that you're contracting through that back passage, lifting up inside, and then it's really important to relax back down as well. So the muscles have several functions. They help to provide circulation to the area. They've got a role in relaxing and opening to give birth and allow you to go to the toilet, as well as a sexual function for arousal, intercourse, and orgasm. And the pelvic floor muscles also help to support the pelvic organs along with the other structures, so the ligaments and connective tissues. And it's really important to understand that just the ligaments and the connective tissue supports the pelvic organs as well. So the connective tissue wraps around the organs and gives that layer of support. And it's important to remember that pelvic floor exercises are not for everyone. So if you have any pelvic pain symptoms like bladder pain syndrome, coccyx pain, or a lot of scar tissue, if your symptoms don't improve with pelvic floor exercises, then please stop and consult your health professional, because you may not be doing the exercises correctly, or you may have an overactive pelvic floor. And that's a pelvic floor that is too tight rather than weak, and you'll require an individualized program of down training, relaxation, and stretches. So just coming to building up our pelvic power. So ideally, the pelvic floor exercises should be supervised, and this is the recommendation of the NICE guidelines, so the National Institute for Clinical Excellence. So if your GP refers you for pelvic floor exercises, they're specifically referring you for supervised pelvic floor exercises under the guidance of a pelvic clinician or a women's health physio. Because studies show that when women are assessed for their pelvic floor, that over 40% are doing the exercises incorrectly. So it's really important to do these exercises supervised. So you want to establish that program for your 8 fast and 8 slow contractions. So we'll give that a go now. So come back to your breathing, so your inhale and your exhale. So just hand on your chest, hand on your belly, and take a few of those deep breaths to allow your pelvic floor to release and relax. And then start to be aware of your back passage. So just breathe in again, purse your lips gently, and then on your exhale, draw in around your back passage and squeeze and lift and hold for 8 seconds. So this is the endurance contraction, and see if you can hold for a count of 8, and then remember to release back down and take that pause in between. So hand back on your chest and breathing in and out, relaxing back down that pelvic floor, and then inhale. And as you exhale, initiating the contraction around the back passage, squeeze and lift inside, hold for a count of 8. And then when you're done, releasing back down. Now, not everybody will be able to hold for a count of 8. So if you can only hold for a count of 3, that's absolutely fine. And then you can try the fast contraction, so that squeeze and release, squeeze and release, squeeze and release, and then take time to just relax back down. So I just want to talk you through the neck. This is a really useful tool to improve your timing of your pelvic floor contraction. So if you cough or sneeze and have a bladder leak, your issue might not necessarily be one of strength, but it might be that of coordination and timing. So the neck is actually a preemptive contraction of the pelvic floor. So a squeeze and a lift before you cough or sneeze, or before you sit to stand, and can be very useful to prevent leakage. So you might be told by your clinician to start by doing the exercises 3 times a day in different positions. So that is, completely appropriate. But we've also learned that our pelvic floor has a relationship with our diaphragm and the other core muscles, so including our buttock muscles, our inside leg muscles, our hamstrings at the back of our legs, our hip muscles, and a connection all the way through our bodies to our jaw and up to the top of our head, through that connective tissue all the way down to your feet. And so it's essential that we start to exercise in a functional way. So by functional, I mean, by training the movements that we do in everyday life. So sitting to standing or bending forward. So if you're sedentary, your exercises will be perhaps sitting based, and if you're more active, in those functional positions. So if you're leaking when you're walking, it's not necessarily going to help if you just stick to lying on your back and doing your exercises. We need to be exercising and improving our whole body strength in all directions of movement, and with resistance as well, so that we can build up muscle, build up coordination, and make these exercises tailored to you as an individual and in a pelvic safe way. So if you enjoy walking, your rehab will be different to somebody who wants to play netball or to run, or if you're disabled, your exercises will be different as well. And just a final reminder, so pelvic health is not just about your pelvic floor. It's influenced by all areas of our lives. So keep a focus on all spheres of health, including stress management, sleep hygiene, exercise, hormone health, diet and fluid intake, and managing that constipation, so that you're putting the right foods in your body, getting that absorption, and eliminating well. And as Leslie would say, let's take charge of change. So when to seek professional help? So we've been through quite a few of the symptoms, but I'll just summarize them again. So when you're unable to wait to go to the toilet, so for those bladder leaks, when you're unable to manage constipation, or if you're experiencing any kind of fecal incontinence, so if you're leaking poo, or you're not able to control wind, 1 in 5 women over the age of 40 experience this type of fecal incontinence. If you feel something coming down, or when you start avoiding activities such as intercourse because of your symptoms, or if you're avoiding going running or the things that you love. And when you have negative associated feelings, so if you're experiencing embarrassment or shame, or you're struggling to come to terms with what's happening to you, just remember that these symptoms are common, but they're not normal, and you are not alone. And they're choices that you can make, and there are tools out there to help you. So there's a list of health professionals here. So just to understand who you can see. So a GP or an accredited British Menopause Society specialist to discuss your HRT options and your topical estrogen, your GP for referrals to NHS pelvic health physios, bladder and bowel specialist nurses, urogynecologists who deal with prolapse pain, any gynecological skin or bladder issues, and urologists who help with the bladder issues and can put a camera inside the bladder if you've got any worrying symptoms like bleeding when you wee. And then the colorectal specialists look after your bowels, and they can perform investigations like a colonoscopy, which is a camera looking up into your insides, and also if you're experiencing worrying symptoms like hemorrhoids or constipation or fecal leakage. And they also deal with issues if you have bleeding when you poo. And then the NHS Squeezy app has got a directory for private pelvic health physiotherapists and NHS physios. So if you want to access information as to your nearest physio, that's a good source of information. And pelvic health physios are able to look at you from top to toe. So they're able to assess your history, and they'll help you to find individual solutions. So remember that we're here to help you. We're here to provide a confidential, safe space for you to talk about your pelvic and sexual health. And we can talk about those worrying symptoms and answer your questions or point you in the direction of people who can. Thank you very much. It was lovely to see you today.
Brilliant. So, thank you so much, Nikki. Thank you. So just moving on to the product support. So Nikki's explained all the great things that we need to be doing and integrating into our lives, and when to talk to specialists. But whilst we are talking to specialists and building up our pelvic strength, there are lots of products out there. Obviously, this is sponsored by Always Discreet. And what is great about the range of products is that there are different levels of strength. So it's important to work out what your severity is when it comes to bladder leaks, and then you can choose the right product for you, so you can feel sort of confident and move around your daily business without feeling impaired in any way. And the great thing as well is with technology nowadays, the absorption and thinness of the products enables everyone to feel super feminine. So those are some products. So just, I'm not really actually going to summarize because Nikki did such a fantastic job, and I just want to say thank you so much for taking the time today and sharing with us all those fantastic tips. But, key message that I got out of there, Nikki, is for us to, be proactive, and that it really, really is worth investing in today. Because that's going to set us up for tomorrow. And if you think about, when we're in our 60s and our 70s, and we've left bladder leakage and other issues and ignored them for years, that's when when things get worse. So early intervention is key. So we've heard about pelvic health, and we're now going to move on to intimate health. I'm very excited to welcome two clinicians who've been waiting patiently in the wings today. It's lovely to have our dynamic Angelas with us today. We've got Dr. Angela Sharma, who runs her own menopause clinic, and Dr. Angela Wright, who is a clinical sexologist as well as a menopause specialist. And together they are proud co-founders of a new virtual clinic, which is called Spiced Pear Health, which is launching later this autumn, which is going to be providing a holistic approach to menopause management, and particularly focusing on the treatment of menopause-associated sexual problems. So wonderful to have you both with us today. Welcome.
Thank you. Lovely to be here.
So I'm going to start with Dr. Sharma in finding out, how do the hormone changes affect people transitioning through menopause when it comes to intimate health?
So, hi Leslie, good to be here too. So obviously you mentioned before that there's hormone changes, and when people are going through the perimenopause and the menopause, these hormones are slowly going down, but also what's happening is they are also fluctuating at the start, and it's like a roller coaster of hormones up and down. And wherever we have receptors for these hormones in our body, we're going to feel the effects of that lack of hormone, especially when it drops. Because we're talking about intimate health, obviously the receptors are all over the body, but in the pelvic area and in the intimate areas, we have a lot of receptors in that area. So before I start going through all the symptoms, I just wanted to make sure that women know that I'm going to mention quite a lot of symptoms, and I don't want people to feel that, especially those women who haven't gone through the perimenopause at this stage, that these are all the symptoms that are going to happen to them. Every woman has a very individual menopause journey and menopause symptoms, and we don't see any two women that are alike or present with the same things in our clinics. So I just didn't want people to get worried about that. But generally what happens in the vaginal and vulval area is these areas are very sensitive to that drop in estrogen, not only to the drop in the hormone, but there's also reduced blood flow to that area. So as you mentioned before, the vaginal skin becomes quite thin, and also it becomes less stretchy. So before perimenopause, you have a lot of these folds inside the vagina, and it's a bit like a pleated curtain, and it helps to stretch and is elastic when you're having sex. But afterwards, the skin becomes quite stiff and hard, and so it's less elastic, and that can cause pain during intercourse or during sex. And also in the vulval area, you can get a lot of dryness, and especially inside the vagina, and so a lot of women can complain of itching and soreness and irritation in that area. Obviously, the other thing that happened that you mentioned was about the change in pH. So what happens, that drop in pH makes the vaginal area more alkaline. And so this can lead to overgrowth of the bad bacteria in that area. And because the bladder is right next to it, you can get a lot more urine infections. And the bladder itself becomes quite thin and leaky. And again, if you can imagine what it would be like if you're about to have intercourse and you've got a leaky bladder, it would just completely put you off. And also pelvic floor as well. And Nikki mentioned about that already. But some women will complain of that prolapse, and the way that they describe it is like that heavy kind of dragging feeling or a bulge in their vaginal area. Again, it's not great for if you're thinking about having sex where you've got that feeling down below. So not only are these changes going on in your vaginal area, but also other changes in the rest of the body. So it's affecting your mood, it's affecting your sleep, joint pains and aches, hot flush, sweats, things like that. So all of these things are together, and they can have a huge impact on your libido and also your desire to have sex. And so all of these things are really important to pick up early and also to treat early. And I think one of the really important messages that I want to get across to women today is that if they have any or one or all of these symptoms, then please go and talk to your doctor and specialist about it. I think there's about 40% of women might have some of these symptoms through their perimenopause or menopause. And only about 25% actually go and see their doctor and talk to them about it. So I just really want to get that message across too. Don't suffer silently, and make sure that you go and see a specialist about this.
Brilliant, fantastic. Well, thank you so much for that. So let's move on now and talk about libido, because this is an area, particularly kind of on our community and Facebook, where people, are talking about it. And there are different reasons, aren't there, as to why it might drop. But what's kind of your advice when desire is low and a person wants to boost it? What kind of helps?
Okay. I mean, I think libido is quite complicated and it's different for everybody. And I like to think of it as being a bit of a jigsaw puzzle, because if you think about having sex, we need to expect it to be enjoyable, not painful. We need to feel good about ourselves, good about the person that we're having sex with. And we also need to have sort of the mental space to be able to enjoy and have time for it. So we're taught in what's called a biopsychosocial model, and all that really means is that libido and sexual problems are impacted by what's happening in your body, what's happening in your mind, and what's happening socially. So if you're going to do things that are going to boost your libido, you've got to look at it in all of those different areas. So we I mean, we start looking at people because of all the physical changes that happen with menopause. I think the basis of what you're trying to do when you're improving someone's sex drive is to try and improve what's happening in their body systemically, and also what's happening in their genitals. So we give usually HRT if that's possible. And I think lots of women tend to overestimate the risks of it and underestimate the benefits. But estrogen is quite important to replace for your sexual function and for sexual touch, to get the blood being sent to different parts of the body that we want it sent to when we're having sex. And we want to give testosterone sometimes as well. So testosterone, like you said before, it's a female hormone. We have 3 or 4 times the amount of testosterone than estrogen in our fertile years, and it is a key hormone in our brain health, in that sort of that desire. So for libido and for arousal, how things feel, how easy it is to climax in sex, those 2 hormones are really important. Some women are going to need that hormone given locally, topically, as a cream or a pessary or a ring. So thinking about replacing that will improve how touch feels and also reduce pain that people are experiencing. And like Angela touched on it, it sort of returns the tissues to how they were designed to be to accommodate sex, makes it feel much more normal, helps us lubricate, which all makes us want to have sex more because it's enjoyable. And then it's about things that are happening with the partner and with your own health generally. So thinking about medications, other health problems, lots of the drugs we use as doctors can impact sex as well and libido. So blood pressure drugs, antidepressants, some of those are worth discussing with your doctor because they can also impact sex. Psychologically, it's about feeling good in yourself and having the mental space and time, taking time out for yourself. And I think socially, it's about thinking about what's going on in our relationships. So women at midlife, some of them are in long-term relationships, and the issues that they have will be quite different to the women that are dating and entering that scene again. Different couples, different relationship settings. All those things deserve, individual attention, but psychosexual therapy can help. Taking the pressure off penetration in sex can help. So rebuilding intimacy and connection, all of those things can really help with libido.
Fantastic. Thank you so much for explaining that. I'd like to move on now to something that a term, vulvovaginal atrophy, which is something that doctors talk about when we have irritation or painful sex, or there might be bleeding in that area. And as I mentioned earlier, that can happen to around 40% of women. And that also can cause sex to be uncomfortable. So Dr. Sharma, we've heard from Dr. Wright in terms of some of the things we can be doing, but what are the things that we should be avoiding to help in that area?
Yeah, I mean, the tissue in that area is very, very delicate, and so we have to look after it properly. And I think because the tissue is becoming dry and sensitive, then you have to be careful what you're washing that area with. And I think it's really important to develop a really good self-care routine. And so one of the things that I would definitely avoid is washing that area with anything that is got any perfumes, any irritants, or any chemicals like parabens. And I think just staying away from anything that smells or got bubbles in it. I think the really important thing is when you go in the shower, that if you do wash that area, then to use things that are moisturizing. So I would use emollient washes, which are things you can just buy directly from the pharmacy. Things like E45 wash or Latem wash, and just wash the outside of the skin. I would definitely advise not to use any wipes in that area or any internal washes or douches, just to leave that area around internally. And then once you come out of the shower, then try not to rub that area too roughly. The skin's so delicate, so just patting dry would be the right thing to do. And then as you come out of the shower and you've dried up, then you want to think about moisturizing that area and bring some moisture back to that dry tissue. And there's several ways of doing that. If you want to go down the natural route, the only thing I would really recommend is coconut oil, and only to use outside and not internally. But you can also use emollients, again, things for dry skin, such as Epiderm or Oilatum or E45. And again, you can buy these moisturizers directly from the pharmacy. There are also internal moisturizers, vaginal moisturizers, which keep the skin moisturized for quite a few days, so a couple of 2 to 3 days usually, and you can use them a couple of times in the week. But I think, again, it's really important to keep a good self-care routine in that area. And then two other things that I would also just add on to that is like Nikki mentioned before, is to really do those pelvic floor exercises. It's really, really important to hold all your organs up, especially for later health. And also it increases the blood flow to that area. So it helps with orgasms and the strength of your orgasms. And then the last thing would be about your bladder and urine infections, and to make sure you see a doctor and get that treated. And then Nikki obviously gave some really great tips for bladder training and fluid intake as well. So yeah, those are my tips for self-care in that area.
Brilliant. And I love that word, you know, when we start to talk about rituals and self-care and being proactive, it is, you know, when we think about moisturizing our face, many of us do that, don't we, kind of as part of a daily sort of habit, and actually sort of our vulva vaginal area is even more delicate. So you know, thinking about that and our pelvic health is important, and it's about finding those habits that we can introduce on a kind of, you know, daily level. So finally, Dr. Wright, Angela, just tell us what other treatments are available that can help remove any discomfort that someone might be experiencing in that area.
Okay, I mean, Angela talked about the self-care things and the moisturizers. I think I should probably focus on the hormonal methods. So we would talk about estrogens as being quite important, and I think I just want to get across that the doses that are used in gels and pessaries are really small, and the absorption through your body is very, very tiny. If you use an estrogen pessary as it's recommended over the course of a year, you get less than 1 tablet of estrogen orally would give you through your body. So these are tiny doses. So for most women, they're very safe, and they come in different forms: creams, pessaries that can be used internally, a ring that sits inside for 90 days and just releases the estrogen over that time. There are some alternatives. One's called DHEA, which is like the building blocks that your body uses to make the hormones. But all these things are important in restoring the skin, helping us prevent infection, helping us to experience touch in the same way, and to sort of get blood flow into your pleasure tissues like the clitoris and so on. We need the estrogen there to allow that to happen. So that's sort of one of the important things to talk about. Lubricants.
Angela, can I say on that, even if you're not experiencing symptoms, is there a school of thought in the way that we kind of start moisturizing our facial skin earlier to start doing that kind of, you know, beforehand?
Yeah, I'm very proactive with women. They reckon about 25% of women who are on HRT will still need to have direct treatment to the vulva vaginal area, and even women that don't want systemic HRT should consider whether they want to have topical estrogens to that area. So yeah, I'm proactive. I think start early before the problems develop. It's quite useful, very safe treatment. There's also, I mean, there are lubricants with sexual activity. So I think if you're having any form of penetration as part of your sexual practice, using a lubricant is really important. There's 3 broad types of lubricants. There's silicone-based, water-based, and oil-based. Oil-based aren't usually safe with condoms for people that are worried about STIs and so on. And one of the tips that we use is to try and combine water and oil-based lube for women that are getting lots of pain with intercourse. So oil-based on you and a water-based on your partner or a sex toy or whatever the penetration is happening with. And then there are lasers and sort of CO2 treatments that are showing some early promise for people that may not consider themselves to be a candidate for estrogen treatment. So lots of evidence that they improve blood flow and that they make the skin a bit more healthy, but it's not an NHS approved treatment at the moment, so it's quite expensive to access it. So a final point would just be that women who may not consider themselves able to have estrogens are increasingly being given topical estrogens safely these days. So that's even after breast cancers, ovarian cancers and so on. So talk to your healthcare provider about it.
There's so many myths, aren't there? So yeah, good advice, and thank you. It's great to hear from both of you, as much like what we shouldn't be doing as well as what we can. So thank you very much for joining. I'm going to let you go as we move on to the final slides, but thank you. That was great.
Thanks, Leslie.
Thanks.
So just, I'm conscious it's 9 o'clock. We had a slight glitch, but I've just got a couple of slides left. So I hope you stay with us. So I'm just going to move on to, so just, if you are interested in learning more, particularly actually in relation to intimate health and vaginal or vulvovaginal atrophy, there's a brilliant book called Me and My Menopausal Vagina, all the basically self-care tips that we've just heard about today. And there's also some videos in the House on Menopause Wellbeing platform. And you can listen out now to the Changemakers, our podcast, where we have a more extensive chat with Dr. Sharma and Dr. Wright. So I'd just like to end really with, go see a specialist, share with people what is going on. The more that we talk about it, the more we can get support. And there are lots of different ways in which we can improve comfort, but actually also be preventative to stop these things happening. So have a look at your habits. It's easy to tap onto existing habits to reform and recreate new ones, and prioritize your pelvic and intimate health. It's so important, and you'll be thankful and be able to enjoy a better life, in future years. So do take a screenshot of this. This is how you can tap into our community at Over the Bloody Moon through Facebook, Instagram, and also you can email me with any questions or feedback from today's session, hello@OverTheBloodyMoon. I'd like to say a huge thank you to all of our clinicians today, and of course, Always Discreet for allowing or helping us to reach so many different people. And do go and visit their website, which is alwaysdiscreet.co.uk /menopause, because there's some fantastic blogs written as well by our clinicians today, along with lots of other fantastic resources. And of course, do check out our website as well. So thank you very much, and I hope that you've had a good session. We will have a look at your Q&As. I know we didn't get a chance today to answer them directly, but we will find a way to answer them. So sign up to our newsletter if you're not already, and then we will be sharing that with you. So good night and thank you, and do tune in next week for our final one, which is mental health and menopause with CBT therapist Simone Stokes. Look forward to seeing you then.